to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. My name is Elena, and I am from Pathway Patient Advocates. Pathway Patient Advocates is a private patient advocate company which serves all 50 U.S. states as well as Canada. And in many states, patient advocacy is a newer concept. And so many people don't really know what a private patient advocate can do for them or really what exactly we are. So I wanted to take some time and talk about that today. We started doing live Q&As a few months ago, and we usually focus on like a different topic each month or every time we do it. However, we always welcome questions about general patient advocacy and so forth. And a lot of times we have letters or inquiries that we have received throughout the month, and we'll share them. So we have Christine, like I mentioned, with our team on today, and it looks like we are going to be talking about the topic of undiagnosed. And so what should you do? So that's a very common area that we focus on advocating for patients. Myself, I have a doctor of medical science, and I have been practicing in healthcare for over 20 years, or working in healthcare for over 20 years. And I have been a private patient advocate for a few years as well. And it's really my passion to specifically help people, especially when they are undiagnosed, and really helping them navigate what they should do in those situations. I've experienced it personally, myself and family, as well as many, many clients. And I really have a place in my heart to help people in those situations. So it's one of my favorite topics to talk about. So again, comment if you can from where you're listening in from. And then also too, if you have any questions throughout our Q&A session, feel free to comment and we'll get to those as well. So Christine, are you able to say hi? I'm not sure if you're on the audio.
Hi, I'm here.
Okay, perfect. Awesome. So many of us may be encountering this topic of undiagnosed at some point in our lives. Undiagnosed, having an undiagnosed symptom, or you go to the doctor with a symptom and you realize you don't actually have a clear diagnosis, or maybe you think it's something, you were diagnosed with something, and then you find out that, hey, that actually wasn't it. You're still having issues, even after the treatment, etc. So it's a situation that could be both unexplainable and concerning. But the good things is there are steps for us to help navigate it effectively, and we do it all the time. And so in this session, like I mentioned earlier, we're going to be exploring this. And whether you are specifically personally dealing with these symptoms, or you have a family member or a friend that is, we can definitely help steer you in the right direction and tell you how we can help. So Christine, did you want to kind of say anything or start with the first question?
Hi, sure, of course. Yeah, so we've been receiving a lot of messages and letters asking about this topic, and this is why we're really eager to do this Q&A sessions to help you better understand the importance of patient advocacy and how we can help you in so many ways. So we have a letter here from Gabrielle. My father has a history of hypertension and has been having a migraines, so he's been seeing a specialist and they said nothing is wrong with him. I believe they gave him the wrong diagnosis, and I need someone who can help us in this situation. Do you think a private patient advocate can help us with this?
Oh, no, I'm so sorry to hear about that. But the answer is yes, we can definitely help. We can help you in several ways, actually. So Pathway Patient Advocates, we're a private patient advocacy company, and finding the right care is really the first thing that we need to do. We need to build your proper healthcare team with experienced people and providers and team members that are really specified and specialized in your area of difficulty or concern. And not only do we help with the medical aspect of it, but we're also very experienced in medical billing and helping you navigate that so that you can financially attain the care that you need to without having to cause more issues in that area. And so we really help you find the most effective yet cost efficient way to help you in your situation.
Yes, exactly. Also, it is important to find a private patient advocate who has experience in advocating for patients who have been misdiagnosed or have a rare disorder. So, our second letter here is from Kim. I was given a diagnosis, but it doesn't feel right. My symptoms don't add up to what my doctor told me, and I'm really clueless, and I want to know why because it doesn't make sense. How can you help me with this?
That's a great question. I also just saw we had a comment mentioning that it's a great topic that I get asked this a lot and had to fight for the last hospitalizations. I am sorry to hear that. That's not an uncommon thing that we hear, is that when you're in the hospital, you're trying to kind of fight for someone to take your symptoms seriously or to further dig and things like that. So, we feel your pain, and thank you for that comment. So, back to the question for that Christine discussed is, I want to say, Kim, I know healthcare is very tricky, but there are many reasons why that may have happened, and I can give you a couple of reasons why. The demands of today's fast-paced healthcare environment leaves little time for healthcare providers to really spend hours of investigating patients' unique issues and case to figure out the best outcome. The system just isn't, unfortunately, built like that anymore. And in the end, the patient truly suffers because they're not really getting the proper diagnosis and care that they need to many times. Office visits are often crunched into like 15 minutes or fewer time frames. Patients are squeezed last minute into appointments because things are short-staffed or there's an overflux of patients. And so really, there's this multifactorial issue. And again, it's just not the most ideal situation to help when you have an undiagnosed issue. So even when healthcare providers really want to dedicate that extra time, their schedule and date and job doesn't often allow for that. The healthcare logistics make it nearly impossible, to be honest. And this issue is often the reason why misdiagnosis occurs. There are so many ways to solve that issue, Kim, and I don't want you to feel alone or terrified, because we definitely can help you through your journey to help navigate that.
Our next letter here is from Brian. I'm working as a truck driver and I've been having constant pain in my abdomen. I know there's something wrong with me, but I want to save time and money so I don't go to the hospital. How can Pathway Patient Navigate help me with this?
Well, thank you, first of all, for your letter, Brian, and I know it must be difficult for you. Did you know that the sooner you can find a proper diagnosis, then you can attain a good management plan? So, half the battle is actually finding the right diagnosis, which you probably do, are familiar with that, or are kind of thinking along those lines. And we can really efficiently help you to find the resources that you need, testing or what be it, to really help you get to that point and determine what the diagnosis is. A lot of times, one of the things that we do starting off is reviewing your medical records to really see where we are, like what has been done, what has been mentioned, what people are kind of thinking, and what areas have gaps there's been, or areas of concern that haven't been evaluated, and things like that. And so when we do that, it really helps kind of us plan for the next steps. And so one of the things that I really spend much of my time on is reviewing medical records. I'm very proficient in that. I have a lot of years of experience in that, and that really kind of will help highlight or stand out areas that we need to either focus on more, or really enhance or dig deeper into, and things like that. And so I appreciate your letter. With a private patient advocate, you're not taking and going through this challenge alone. We're there with you. You don't have that feeling of, or at least less of a feeling of that uneasiness when you go to an appointment, because you're prepared. You have somebody that's, with you to really help go through this and ask the appropriate questions and so forth. We're here to walk by your side and assist you through your path. Even if you're fortunate to have family members or friends by your side, it's comforting to know that you have your very own private patient advocate with you, looking out for your best interest.
Okay, so our last letter here is from Lily. I've done a lot of tests and referrals, but my doctor can't seem to give a diagnosis. I am sick of going back and forth to the hospital in hopes that someone or something can help me get the right diagnosis and treatment plan. And I need help. How can you help me with this?
I'm really sorry to hear that, Lily, but I can assure you that with a team of expert and experienced patient advocates, we can help you get the care that you need. The first thing we would need in your case is, again, like I mentioned before, is to really review your medical records, check for areas of lapse, and see if we need more testing, evaluations, etc. As your patient advocate, we can coordinate your doctors and providers that you're currently seeing to develop a plan to achieve your goals. And you don't have to go through it alone. We can really help prepare you best so that when you are going to appointments, they're as effective as possible, as efficient as possible, and that the follow-up occurs in an appropriate manner. So please don't hesitate to reach out to us for help.
Yeah, thank you so much for sending us the letters just like this. You can send us a letter in our email. Our email is advocate@pathwaypa.com.
Well, if you do think of anything, please feel free to give us a call or send us an email like Christine mentioned. Our number is 947-517-8395, or you could always message us too on Instagram and we can reach out to you as well. So have a great night, everyone. And thanks so much for joining. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.